Welcome back. Trump, Cruz, Carson, Hillary, and Bernie each has a plan to improve health care. Take a listen.
We're going to get a plan where people compete, free enterprise, they compete so much better. In addition to that, you have the health care savings plans, which are excellent.
Will allow people to purchase health insurance across state lines that will drive down prices and expand the availability of low-cost catastrophic insurance. We'll expand health savings accounts, and we will de-link health insurance from employment so that you don't lose your health insurance when you lose your job.
I have proposed a health empowerment account system. Everybody gets a health empowerment account the day they are born. They keep it until they die. They can pass it on. We pay for it with the same dollars that we pay for traditional health care with.
I am absolutely committed to universal health care. The Democratic Party in the United States worked since Harry Truman to get the Affordable Care Act passed. We finally have a path to universal health care. We've accomplished so much already. I do not want to see the Republicans repeal it, and I don't want to see us start over again with a contentious debate.
My proposal: provide health care to all people, get private insurance out of health insurance, lower the cost of health care for middle-class families by $5,000. That's the vision we need to take.
Senator, if I can.
Joining me now is cancer surgeon Dr. Dmitri Aiden, holistic doctor Robert Silverman, and the author of the New York Times bestseller, The Obamacare Survival Guide, Nick Tate. I'm going to start with the two doctors here, one of which walked in and said, "How are you feeling?" All right, question for you. Actually, let me say it different. I am a victim of Obamacare, all right? I had a great plan. Then Obamacare came in. I lost that plan. I had a new plan. Then I lost that plan. They took it away from me because the place went out of business. Now I'm getting it back. I'm paying more money than I ever paid before, and I'm getting less services. Are you seeing this across the board, or am I just like one of those rare birds?
No question about it. We see this across the board. We see it with all the patients that come into the office, and there's several major impacts. Number one, and I've said this before, people who have high deductible plans are virtually uninsured until they met their deductible.
That's me.
And what's happening here is a very important thing. There's a significant decrease in utilization of healthcare, which drives down the cost of healthcare initially. Great idea, right? But at the end, people don't come for regular checkups. People don't come, in my situation, I'm a liver cancer specialist, they don't come on a regular basis to follow up after the cancer operation. And as a result, they get sick, and that only at that point they start to use the health care.
And I want to get to that. I want to get to that because a big thing we're going to talk about is prevention versus treatment. I want to move over to you. Are you seeing the same thing, doctor, when it comes to the Obamacare?
Yeah, I'm seeing distinctive changes in, as you had said, deductibles, so people don't want to utilize and come in. I'm seeing people not understanding their coverage, and that's a big problem. So, for instance, I'm a chiropractor. I do a lot of nutrition. They took a lot of the prevention away. So that's a major problem. My perspective, if you want to decrease cost, is get people healthy before they get sick.
Now I want to get into that. You know, you familiar with Governor Mike Huckabee?
Of course.
Okay, he's a friend of mine. And because I used to do a lot of stuff on Fox, I remember being around one time, and he gave his monologue, and he said the problem in this country is the fact that we are a treatment-based healthcare system versus a prevention healthcare system. You agree?
Absolutely. The perfect example is Japan. In Japan, there was a huge problem with esophageal cancer because of the type of food they eat. And it was mandated for employers to send the employees for regular checkups. What happened? The number and the incidence of esophageal cancer has significantly dropped because of the preventative measure of regular endoscopies in the employees. And that's a perfect example how the prevention can work on a big scale. In my profession, I deal with a lot of liver cancer that comes from hepatitis C, and now we can talk later about it in the future, it's going to be fatty liver disease. If we don't intervene now, what's going to happen? This is already projected by the year 2025. The number one reason for liver transplantation in the United States will be fatty liver disease.
Totally preventable.
Totally preventable.
Yeah, I mean, another thing, right? Move over to you, doctor. When I was a kid, I mean, pretty much all within the same age group here. I remember when I was a kid and I went to school, maybe we had one heavy-set kid. Maybe two. Now, I got a second grader, I drop her off, half the school. Half these kids are brinking on being obese. These kids, as they grow up, I mean, are we going to even see what's happening now even get worse? I mean, diabetes is on the top 10. We got heart disease, cancer, stroke, all these things can be prevented.
To speak to that, since 1971, when the U.S. government came in and changed our guidelines from fat, enabled us to eat carbohydrates, and a lot of the different corporations have increased the kinds of fake carbohydrates or bad carbohydrates like high fructose corn syrup, we now have an increase in diabetes and a parallel increase in obesity. We used to call type 2 diabetes, it used to be what? Type 2 diabetes, adult onset. They can't do it anymore. There are too many children that have it, so they call it type 2 diabetes now. My goal, my suggestion is start teaching people how to eat. Change your lifestyle. Do some incentives for making people healthy. Let's talk about functional medicine and functional nutrition. Let's start getting into the schools. Let's start teaching people. Let's start teaching parents how to feed children.
Prevention. Prevention. Nick, let me go to you, pal. When you hear these candidates, right, we played them all. When you hear these candidates, who has the best plan?
Well, I think you have to evaluate which plan is likely to drive us toward more prevention. The problem with our healthcare system in this country is, first of all, it's very costly. We pay twice as much per capita as any other country in the world, yet we trail many countries, if not all wealthy countries, when it comes to the for the death rate from preventable diseases. So the question is, what are we really getting for the bang for our buck? The evaluation that I make in determining which candidate has the best plan, one of the issues for me is none of them are really talking about prevention. We know what prevents obesity: eating a healthy diet, getting regular exercise, stress reduction, getting a good night's sleep. But obesity-related healthcare costs total about $150 billion a year. And to my mind, the most obvious gap in Obamacare is there's virtually nothing in it that drives prevention. Now, we know that prevention works. We know that if you give people financial incentives to eat right through taxes, through workplace wellness programs, and through their insurance, they'll eat right, they will get to a gym regularly, people will join Weight Watchers, they'll quit smoking. These are the kinds of programs that I don't hear anybody really talking about that should be a part of health care reform. None of the candidates on either side are really addressing it.
That was the right answer, because that's the whole thing. I mean, all these guys are basically another treatment-based stump pitch, right? I mean, you hear these guys speak. I mean, who did you like best? And I don't mean as your president. I mean just from healthcare.
Well, I would like to start with who I don't like, or whose plan I don't like, because I immigrated into the United States from Soviet Union. I grew up and I went to medical school initially in Soviet Russia, where the universal healthcare system existed. Universal, no healthcare, really, because I went through the education and I worked a little bit there, and I saw how people were treated, no prevention. And even the intervention was very hard to accomplish because it impacted the education, it impacted doctors' behavior, it impacted the incentive for doctors to work. And what else it did? It degraded doctors. As a result, the whole bribery system came up on the market, and it existed there for a long time.
Okay.
So do I like Bernie Sanders' plan for universal health care? And I would like to eliminate the word universal health care because it's not true, it doesn't exist. And we have a perfect example in the United States of universal health care: Veterans Administration.
Yes.
Look at that.
Yeah.
Look at all the disasters and problems that we just witnessed in the last several months. That's what we will be seeing in the United States if the universal health care, or rather single-payer system. Right.
Jumps into there. What about yourself, Doctor, when you hear these guys?
I don't like any of their plans. I think I'm almost ready to throw my hat in there and talk about health care. Hopefully one of them want to hire me. It's all about prevention. Mm-hmm. We have over $1 billion that we're spending on our health care because of obesity and diabetes, and nobody's talking lifestyle. It's all about lifestyle. People should consider getting exercise, they should consider getting a different kind of diet, and they should supplement themselves correctly. When you think about the lost money in wages and productivity, it's $1 trillion. So Jim Rome once said, take care of your body. It's the only place you have to live. You can't buy health, but it's a very valuable savings account.
Do you think, I mean, I got about a minute left here, Nick, a little bit more. You know, everybody talks about repealing Obamacare. They're going to repeal it. Do you really think that's a reality, or are we stuck with this thing?
You know, it's my opinion that Obamacare's been with us for almost 7 years. It's going to be very difficult to uproot it from the very bottom. But I do think there are changes that can be made, changes that would bring some cost controls, things that would emphasize prevention, changes that would allow you, for instance, if you join a health club, you quit smoking, you join Weight Watchers, you should be able to get a break on your health insurance. Just as if you are a safe driver, you can get a lower rate on your car insurance. Why don't we see that happening more? Expansions of workplace wellness programs, which have saved companies like IBM and Target hundreds of millions of dollars a year. They're getting that there are financial gains to be made at the same time that you are also benefiting the public health. So I don't think that we're going to see an outright repeal of Obamacare. It's been with us for too long, but I think there are major changes that could be made regardless of who ends up in the White House in 2017, and should be made.
I agree with the fact that Obamacare is virtually unrepealable, not because of the law. You can repeal the law, but you cannot undo the dramatic changes that happened in this country in the last few years. If you look at the publications for instance, we take American College of Surgeons, I'm a surgeon.
10 seconds.
Right now, the number of private physicians have dropped to like nearly 15%. It's almost over. Large corporations took over, and changes happen.
No, guys, I have to end it at that. I'll have you back. I mean, this is going to be a topic that we're going to be discussing for months. We'll be back.